Hello and welcome to the Inclusive Health Podcast, where everyone belongs and every story matters. I'm your host, Jace Stephens, owner and practitioner at Inclusive Health. I'm here to help you navigate healthcare with more clarity, compassion, and confidence. This podcast is designed and produced by Tatum Dodd of Oddfellow Creative. Each week we'll break down myths, focus on various health topics, answer your questions, and share real, inclusive conversations that support your wellness journey. Thanks for joining. Hello again, this is Jace Stephens with Inclusive Health. We're here for our third installment, speaking with Rema regarding her kidney disease and renal transplant. So take it away.
I think I mentioned in episode 1 that I was eating a keto diet, high oxalate diet. So I wanted to kind of go into that so people understand more about the kidney stone diet and the renal diet and how they work together. Okay. You either live a kidney stone lifestyle, right? Or you live a renal diet lifestyle. So I've had to intermingle these two things. And I think it's important people understand what they're taking in every day. We live in a society of obesity as well as massive health issues. We live in a world of convenience, and that's come to play in a way that's really detrimental to our health.
And food is medicine.
I agree, 100%. Maybe that should be the name of this episode. So let's talk about kidney stones and kidney stone diet. I had to learn what was affecting my kidney stones and creating them, how and why I was creating them. As soon as I learned that I had kidney disease and realized that it was due to massive kidney stone production. What I learned is from, actually she's a nurse, and her name is Jill Harris, and she runs the kidney stone prevention diet. I suggest every single person who has any kind of issues with stones or any kidney issues, research Jill Harris. I'm going to plug her. She's not paying me, because she changed my life. What I learned is that by ingesting fruits, vegetables, grains, the form that you're ingesting them in creates a dependency for your body on oxalates. Let's do some examples. I see everybody eating spinach every day. It's in everything, from healthy foods to snacky foods. The amount of oxalates in 1/2 cup of spinach is more than I would ever eat within 5 days. I'm allotted 100 oxalates a day. 1/2 cup of spinach has over 500 oxalates in it. For someone who can't process that, like me, that just means that I'm going to be building kidney stones as soon as those hit my body. Same with things like almonds, almond milk, all these new nut milks. They may or may not be very healthy for you. So that's what I'm trying to convey to folks. Jace has had dinner with me. You know, we've known each other for quite some time. We've shared broken bread together. And there have been times that he's like, oh, can you have this? And it's constantly like, I can't have this. I can have this. I can have that. I've had to memorize every little thing that I can put in my mouth. Now, there are certain things that I'm not trying to scare people. It's a matter of attention to what you're putting in your body, right? I'm not a dietitian. I'm not a nutritionist, but I'm someone who has learned to the nth degree what is good for me and what isn't. Now, you know, we've talked about you've had kidney stones in the past.
Diagnosed, but I feel like I've passed a few stones.
He's a normal person. He doesn't
I don't
have
know if
them.
other people would say that.
Yeah, but the capacity in which you create things is not the capacity that I do.
Every person is not the same.
And so that's what we want to convey today. Talking about kidney stone health as well as kidney health and how you can intermingle those two things while also understanding the intensity of the amount of phosphorus, potassium, and sodium in your body you're ingesting every day. If you have any kind of renal issue, if you've ever had an acute renal injury or have found out that you're in any kind of stage of chronic kidney disease, understanding your renal diet and what you can and cannot do, the main thing for everyone is to watch your sodium levels. When you go to a restaurant, do you actually look at the nutritional facts? Or are you just interested in that greasy hamburger that you wanted to have? That's a treat, right? I think that our society is just not playing enough importance on this. It's kind of like a puzzle for me. It's a chemistry lesson. I'm putting the equation together. I have to mix 2 diets. I have to make sure that I'm not ingesting so many oxalates, that when I do ingest oxalates, that I have some form of calcium to keep oxalates in my digestive tract to come out through my waste as opposed to going into my urinary tract and going into my kidneys so crystals don't form. Does that make sense?
Yes.
A renal diet, say you have kidney issues, it's completely different. So this is where I want people to understand, please watch sodium. Please watch the amount of potassium. If you have too much potassium in the system, you can have a heart attack. You know, that's what's really at risk here. It all flows together.
And sodium can affect high blood pressure and other things too.
So it's just more along the lines of making yourself aware of how things work together. I follow the Harvard oxalate list. Harvard has a massive list of foods and the amount of oxalates in each. So I'm constantly mixing and matching with what I can intake. We can provide that to you or you can research it yourself. If it's something that's concerning you, especially people in our area, Middle Tennessee, research how many people have kidney stones in your area. If it's high, you may be affected. There may be an outlying factor that you are not aware of that may just be outside of those oxalates. This is my diet now. A kidney stone and renal diet mixed together. My life is changing. I'm going to have my kidneys removed or have a bilateral nephrectomy, and I will go on dialysis. And that means my diet will change again. I kind of wanted to go into dialysis. It's a really big, scary word. And I've been really fortunate to be part of a lot of groups that help people each day understand and deal with living on dialysis. They have the most positive attitude you could ever imagine. They are never defeated, it seems like. This is life and this is the way it goes. I'm going to wait for my kidney. And when I get it, I'll get off dialysis, hopefully, and we'll move on. I don't want the fear factor that I've experienced to disallow everyone else to understand what's really happening. I had a friend, when she found out I had kidney disease, she's an amazing human, very intelligent. She's a legal professional. She looked at me and she's like, well, don't you just have dialysis once and then never have to have it again? I realized that the public doesn't understand that people who are on dialysis, they have to do it 3 or 4 times a week. Some of them have to do it every day. And it is very trying on your system.
It's like hours.
Yeah, it's up to like 4 hours a day. If you do it overnight for PD, which I'd love it if you would go into that, do it for 8 hours while you sleep. Once you start dialysis, your life expectancy decreases by 60% immediately the first time. Those statistics, they're reality. It's not just, somebody crunched some numbers and pulled it out of their hat. This is real. This is what people are living with every day. That's why there are 125,000 people waiting for kidneys. Jace, would you mind going into dialysis and the different forms of dialysis?
So there's hemodialysis, and that's where you'd have either a fistula that they surgically implant into your arm. It's where they connect your artery and vein together so they can access it with a needle that way. Also, there's a central venous catheter that can go into your chest. It's going into a big blood vessel into your chest. So those are where people usually go to a renal dialysis center at least 3 to 4 times a week. They're there for usually a half a day at a time. There's peritoneal dialysis where they put a catheter into the abdomen. The stomach lining acts as a filter. There's more of an ambulatory dialysis that you can go about your activities of your day. There's one at night where you dialyze it for 8 hours.
Yeah, PD. Everybody wants to be on PD, to be honest, because it's the easiest on your body.
And you get to do it at home. You don't have to go to some center and sit with a bunch of other strangers half a day.
That's right.
They probably get to know each other and become friends, or you see the same people there, which is unfortunate, but it's good to have community.
It lessens the fear factor because you're not alone, But I really feel like people need to understand that it's not just your grandmother going to dialysis. There are children on dialysis. Kidney disease affects everyone, no matter what age you are. There are infants that find out they have kidney disease. Their parents find out they have kidney disease. It's non-discriminate, and it can affect you due to your lifestyle in ways that you never knew. So I feel like the more people talk about it, the more we'll know. I had no idea about this when I started this a year ago. I had no idea.
Well, I was very surprised with your labs just because I know you're feeling the effects of it now, but you were just living your life and felt normal. I had never seen anyone's kidney function like yours and the way you felt at that time. I was really surprised that, at that time you're just living your life and didn't know anything was wrong.
Yeah, it was pretty wild to have no symptoms and 24% kidney function. And then go to specialists and they're like, how do you feel so well? Now that has dwindled over time. I feel this well. I have arthritis. I have pain. I pass kidney stones daily because of the fragments broken up in my system due to surgeries. They don't just come out naturally with urine. They come out whenever they want. So it's a game every day of living your life and like, okay, am I going to be able to go to the grocery store today?
And painful. They're like sharp little rocks.
It's just insane to think that there are rocks being formed inside body, like sharp glass-like minerals that have crystallized into daggers inside your tiny kidneys. It's wild. Just trying to make everyone aware of how to deal, how to cope, where to get information, and how to take care of yourself. Anybody can form kidney stones. To be honest, the damage that those cause to your nephrons, to your kidneys themselves, to the filtration of your kidneys, to your ureters. I'm not trying to be too graphic, but I have blood in my urine constantly. But guess what? I can't see it. It's not visible. And that's weird.
Thing that you could catch through an annual physical if you didn't know you had blood in your urine.
Exactly. It's mind-blowing to think. You get a test and it's like, there's this much blood in your urine. There's this many white blood cells. And you're like, where is this coming from? And why can't I see it? It's dangerous. Let's talk a little bit about food and how to navigate. Currently, I'm eating a renal diet and kidney stone diet mixed together. Low oxalate, low sodium, low phosphorus, low potassium, low sugar, low fat, which means I can eat food, but there's very limited amounts of it that I can eat. It takes a lot of planning. It takes a lot of creativity. I can't just go out with my friends and eat whatever. I got to eat ahead of time, or I've got to go make sure that in meal plan. So being aware of that and having those resources available to you. Not everybody can just go to the grocery store whenever they want to. Not everybody can afford to, especially anymore. One thing I have done is become a vegetarian. And I will tell you that my grocery bill has decreased by half by doing that, as well as keeping my creatinine levels lower, which is highly important. Protein is another factor with kidney issues. This high protein lifestyle that I see 23-year-old guys ingesting 12 eggs and then a whole pound of hamburger and drinking olive oil, please stop doing that. Or go talk to your doctor or get a dietitian and see if that's really good for you. Because I go to doctor's offices very frequently and nurses come to me and say, my child just discovered their kidney function is lower. I always ask, how much protein are they eating? Well, they eat a lot because this is what we need in our diet now. Is it really what you need? This is the stuff that I want people to think about.
Well, like we said, everybody's individual and everybody might not need the same thing.
Exactly. Eating for your labs. That's what people who are with kidney disease do. They learn their labs and then they work and gear their diet towards that. If I have high potassium, if I have high calcium, if my calcium's a little higher in one lab, then 3 months later, my doctor is immediately telling me, I need you to lower the amount of calcium you're ingesting so I can remove oxalates from my urinary tract. It's just a whole process, right? It's like a chemistry lesson every day of my life. I feel like I'm harping and I don't want to harp. I just want people to be more aware. I feel like in the day and age of modern society and carnivorous diets, we're not really paying attention to the things that can affect our organs.
Yeah, you just don't want anyone to go through what you're going through.
No, I don't. I really don't. So we've talked about that. I'm on a renal diet and kidney stone diet. Once I start dialysis due to my kidney removal, I will be on a higher protein diet. I may not be able to have any potassium. I may not be able to have, who knows what will happen then. It's always the luck of the draw of whatever the blood that's drawn from you and the labs. Then I will go to another dietitian and they will tell me, okay, now you will eat like this. And this is what I have to do. And then once I have my transplant, I have to start another diet. And I'm saying that with hope. I'm saying that as someone who believes and has faith that they will have a kidney transplant and it will come from a living donor. That's really my only choice at this point because I can't go on a kidney waiting list because I need a nephrectomy. So it is a very long and arduous journey to get where I am now, to understand that I'm dependent on someone else in the world who could help me, and that's just not who I am. I'm not someone who depends on other people. I've always been very independent. So this is a lot for me to ask and very hard for me to ask, but I need someone to step forward and fill out a form and just say, hey, I'm willing to do this. My blood type is A. I can accept a kidney from someone who has A blood or O blood, and that's where we start.
I have a lot of patients come to me asking to check their blood type. I'm not able to do that. Usually that's done before you have surgery or you're donating blood, but they do have a kit on Amazon for $10 that you can order and find out what your blood type is. In less than 10 minutes, you find out your blood type.
I mean, you can save someone's life. Even if you sign up to be an organ donor, a deceased organ donor, you can save, it's not just saving one person's life. That is saving, you could save, I can't even count because your tissues and all of your organs, your eyes.
Yes.
I mean, it is every aspect of, and everyone needs these. People all over the world need these things. So please consider, if you can't do this as a living donor, please at least consider doing it in your demise. We need, this world is not full of hope anymore. We need hope. This is something that people can provide. I've been an organ donor since I was 16 years old. As soon as I was able to do it, when I got my driver's license, I've signed up to be one. So it's just something that comes naturally to me. I've always wanted to do that. I don't know. Everyone's different. What's going to happen once I get my transplant, which I said I'm standing in faith. We had an episode with Tiffany Drake, my best friend who donated her kidney. The lifestyle for her is so different than the recipient's lifestyle. The donor goes right back to normalcy. The recipient doesn't. The recipient has to monitor their sodium, phosphorus, potassium, fat, sugar, protein.
Anti-rejection medications.
Yes. And then there's also the aspect of illness after being ill and receiving an organ to make you well. Kidney transplant recipients have to take autoimmune suppressants. That means that they really can't be around people for so long after the operation.
put you at risk for getting illnesses very easily.
Yes, it suppresses your immune system where you are unable to fight infection. This coincides with cancers, chronic illnesses, viruses, and just your common cold that could be really detrimental to these folks. Be sensitive. If someone has gone through this, be aware of your health when you're around other people. This is something we learned during the pandemic, and not everybody adheres to it, but it's transcending to other aspects of people's lives. So that's really my soapbox. I didn't really go into the diet, and I don't think that professionally, that's not my job, okay? But I want to make you all aware that you need to be monitoring the amount of sodium that you ingest in your body. You need to be making sure that your kidneys, everyone, your amount of sugar that you're ingesting, all the way to the potassium and other things, and how they all coincide with each other. And getting your physicals, your yearly physicals, just so you can say, hey, you know what? I'm doing great. I would love to be able to say that. This is another thing. Someone said to me recently, well, you don't look like you're sick. Well, you're right. I don't look like I'm sick, but I don't know what sick looks like to you. My numbers and my labs will tell you something differently. My daily pain and my daily anguish in dealing with this would tell you something differently. But I don't want to go into that with every single person, and nor am I here to judge other people and what they're going through. So please be sensitive to that as well. Okay. So that's really all I wanted to say. And thank you for giving me this time to do it. I appreciate it.
Thank you for sharing your story.
Yeah. I've got more to say, but maybe another episode down the road. We'll have a follow-up.
Yes.
Thank you for being with us.
Thank you.